Hi everyone, Dr. Mike Ferguson here. Just want to take a few minutes to talk about helping someone that is having an acute stress disorder, gone through a traumatic event, or is facing a panic attack. Or maybe you've gone through or having a panic attack, and you have those quite often. It's very, very common for people in our society to be facing a panic disorder, and they come on very similar to what someone is having a heart attack, and it's the very same kinds of symptoms. And that's why if you don't know that you have panic, or you don't know that you have some type of an acute anxiety attack, I want to encourage you to make sure you get your heart checked out, make sure you see your primary care physician, make sure that you go through the process of making sure that what you're experiencing is not some medical heart condition, but it is a panic attack. Because panic attack will actually show up in symptoms of palpitations, a pounding heart, a rapid heart rate, sweating, trembling, shaking, shortness of breath, sensations of choking or smothering, chest pain or discomfort will show up with panic, abnormal distress or nausea, dizziness, lightheadedness, feeling faint, unsteady, feelings of unreality. You become sort of detached from what reality is going on, feelings of being detached from oneself, fear of losing control or going crazy. You have this fear of dying, numbness or tingling, chills or hot flashes. All of these are things that show up when someone has a panic attack or an acute anxiety attack. And I may be talking to someone who is having that very thing. And so how do you help? How do you help someone who's going through that? First, you want to ask them if they have a panic disorder, or if they feel like they're having a heart attack. Oftentimes, people will tell you that they have been diagnosed with panic, and that lets you know right there that there is a way for you to be involved in helping that person. One thing we do know clinically through research is that panic usually lasts only about 20 minutes, and it peaks at 10 minutes. And so one of the things that you can do is reassure the person that they're going to be okay, that they're not going to die, and that it'll last for about 20 minutes. It'll peak at 10 minutes. It doesn't mean that that's going to make them any calmer or is going to make them feel any more relief, but at least you're there speaking into their life, and you're being able to say to them, you know, this will not last forever. You're going to get through this. You'll be okay, and I'm here to help you. Now, the one thing you don't want to do is you don't want to touch somebody if they're going through a panic attack, unless they want you to, or unless you feel like you can. You might ask them first if it's okay for you to put your hand on their shoulder and to ask them if it's okay. And then that may give some reassurance. If you're in a crowded place, in a place with a lot of people, you can help move that person to a quieter place and allow them to sit down. And then one thing you might want to encourage them to do is to start breathing a lot deeper, and that will help them to reduce the panic that they're facing. And it might be something that you can do where you say, follow my breathing, and you breathe in through your nostrils, out through your mouth, and do it in a very slow way. And that way someone can follow what you're doing, and it can help bring some calm to them. So remain calm yourself. Avoid any kind of negative reactions that you're feeling as the helper, as the person. Reassure the person that he or she is going to be safe, and the symptoms will pass. They're temporary. Just be very patient. And acknowledge that the terror that they feel is real. Don't negate it. Don't downplay it. Take it very seriously. And if this is you, you can use these same techniques and these same approaches for you if you yourself are having a panic attack. So I hope this helps you in some way, and we look forward to bringing more of these kinds of videos to help you in the area of mental health and mental illness and just having a crisis. And we hope this helps you today. God bless.